Aloha, guys. Here we are. We're back again. Dr. Thomas back. That's my hand up here. No, it's not, thankfully. Dislocated fingers is what it says. Broken, dislocated. Yeah, this is bad, guys. They're broken here. Here's the thumb, index, ring, and so on. And you see all the directions they're going. Yeah, this has been badly damaged. That would take quite a bit of surgical intervention to help. And it may never be back. I don't know. That's because, see, when it gets dislocated like that, guys, it damages the ligaments and stuff. And bone in a normal individual will heal up pretty well because it has a lot of blood flow going to it. It's very dynamic, osteoblastic and clastic activity. But these soft tissues are unforgiving. They don't heal as much. Now, what does it say? A drill bit through the brain. Yeah. Now, again, without having an A to P view, we can't see exactly whether it went right down the center or over to one side. Or if it's in the center, it's bad because it's going through the brain stem and all, and that's unsurvivable. So, but I imagine this would be anyway, but you never know, guys. Okay, here's supposedly what an airport scanner shows. I think this is a female from what appear to be breasts and from the shape of the pubic area. So I don't know if that's what they see now, but that's what it says here. All right, here's a lateral neck and head film with what looks like a spear going through it. Again, without an A to P, you can't tell exactly. That's why it has to be two perpendicular to each other. Sometimes you take 4 or 5 views, guys. It just depends. Here, I guess, are nails or needles or something. Here they are. They're pointing it out with an ink pen. These are needles, I would guess, and they look like they've been swallowed. Well, see, this is a kid. How can we tell? Look at the hip joints. See how the bones aren't fully formed? There's a lot of space. That's because that's cartilaginous. In children, that's the way it is. So this is a kid that looks like it's swallowed. Oh, it says metal nails here. Could be. Maybe a little big for to be a needle. Okay. But see, it's sort of in the pattern of the intestine, of the colon. So pruning shears in the skull. Oh, that's rough looking. Part of it, part way impaled. I'm not sure. This person's lying down. Naturally, it's a lateral view. So I don't know. It looks like, yeah, it's been chunk. Again, metallic objects show up pure white. Now you might say, well, Dr. Tom, why is this white in here? That's because you're seeing thick bone on end, and so you're seeing multiple layers of it, so it's denser. And basically, the more dense something is, the whiter it shows up in X-ray. The less dense, the more black. It's the same here. See, we're seeing the edge of the cranium, and because we're seeing that bone edge on it, it's thicker, and so therefore it's whiter. Of course, metal is the whitest, the densest of all. Okay, now here's something else here they're saying needles. This is an A to P pelvic view. Here's the lumbar vertebra, the sacrum, hip bones, the femurs, the hips. This is gas in the colon, which is normal. You should have that. So yeah, somebody swallowed some needles here because it looks like, again, it's sort of following the path of the colon. And see, this is gas, so because it's gas, it shows it's less dense, and so it shows up black. See, does that make sense, guys? Think of an X-ray as exactly what it is. It's like a photographic negative. The difference is you're seeing the front and the back all the way through all at one time. So it takes a practiced eye. You have to be trained in how to read these things. Here's some coins. Coins in the intestines. Again, another A to P pelvis, lumbar. Here are the ribs, pelvic bones, gas in the colon, feces. So somebody swallowed down a bunch of coins. And this doesn't look to be a little child. It might even be an adult. Okay, now everything we looked at up to now, guys, is regular X-ray. This is either an MRI or a CAT scan. And I'm not trained in them. Guess what? When I was going to school, they had just discovered the use of MRI in medicine. They were using it in chemistry before that. I did my pre-med at the University of New Mexico, and in organic chemistry, they were talking about this exciting new device. They called it NMR, nuclear magnetic resonance, and they were using it for all kinds of great things in chemistry. 3 or 4 years later, when I was in chiropractic college, they had just taken the NMR technology and developed the MRI with it. Okay, now what these are bags of drugs being smuggled. Bags of drugs being smuggled. And this is either, but see how the MRI shows this neat three-dimensional, or cat, whichever one it is. They've got an oral contrast in it too. They made them drink to make it show up more. So this person is in some trouble. Here's another. It just says, what's it say? Metal object in the skull. Looks like it's in this area. It's rough. Okay, guys, here's a pair of conjoined or Siamese twins. Now, of course, Siamese is not the proper term. That's what the public calls them. And they look to be conjoined at the sacral area. So these kids could be surgically separated, because they got, looks like, pretty much all their own organs and everything. Just down here we get to the sacral area. But conjoined is the more appropriate medical term, but Siamese is like the old street term for it. Okay, this person swallowed a ring. This dude here got mad at the babe. I'll show you. And wing, so there it is. Now, probably it would pass on its own in coming days when he went to the bathroom. I don't know what this is. My God, whatever it is, it's very dense. It's like a cannonball. It's taken up the entire pelvic outlet. I don't know, man, what that is. Phineas gauge, what? I've of course, seen these before. Here's an iron bar rammed down through this person's skull. Come out the zygomatic arch, which are the cheekbones, but you can go behind them anyway. But not with a pole this big. You'd have to smash your way through. Oh, this is an actual case. Okay, Phineas Gage, yeah. He was a work-related accident. He got this iron pole, impaled through his head. And he lived after that, survived for many years. This is after he's healed up some. I don't know if it took that eyeball out or not. And they studied him for decades. I don't know how he might have lived like 20 years or more, or 30. And it's funny when I think it talks about it in the book, I believe, Phineas Gage. If you read about it, he suffered. Sometimes he suffered from depression, and sometimes he had anger issues. I thought, yeah, hell yeah, I would too if I had a metal pole jammed down through my head. I'd be pretty darn angry most of the time too. But it actually was very interesting and added a lot in medical knowledge and stuff. But now this must be just a drawing, because he had this happen years before X-rays and stuff. So that looks like some sort of a drawing. Maybe I guess they still got his skull and everything, probably. Okay. Oh, well, that was kind of fun. I don't know what possessed someone to sit on a Coke can, but we're not going to worry about it. Okay, CT, very important. CAT scan, super X-rays that show soft tissues. Perfect definition. Contrast studies. Materials used to allow soft tissue to be seen better on X-ray because they create a contrast. Some of them are given by IV, some of them are drank, some of them by enema. Gamma camera, machine to detect gamma rays emitted from radiopharmaceuticals. So in other words, guys, there's certain drugs that they can, radiopharmaceuticals that either are already naturally radioactive or they can make them that way. And they can inject that into a person, and certain tissues take this up, and then they can take pictures of it. And that's what the camera does. Gamma rays, high energy rays emitted by radioactive substances and tracer studies. Very, very high energy. Half-life is the time required for a radioactive substance to lose half of its radioactivity by disintegration. Some of these things have a half-life of 10,000 years. Interventional Radiology, the therapeutic or diagnostic procedures performed by a radiologist. Okay. Now, we've gone over this a couple times, but it's important. In vitro is outside in a petri dish or a test tube, and in vivo is within the living organism. Process, test, or procedure. Ionizations. X-rays have high energy and can knock electrons off atoms, producing ions, which can cause cellular damage. It's ionizing radiation, guys, is the one that's dangerous, that causes the biological effects. X-rays are set up with collimators and different things to keep that to a minimum. MRI is use of magnetic field and radio waves to produce detailed images of the body. Amazing stuff. Nuclear medicine. Medical specialty uses of radioactive substances in diagnosis and treatment, like cancer. PET scan, positron emission, antimatter, use of positron-emitting radioactive substances like glucose given intravenously to create a detailed image of cancer-infected tissue. Remember, it'll glow because they'll be sucking up more of that radioactive glucose. I don't know how they get positrons. A positron is the antimatter particle of an electron. We all remember, electron has a negative charge, and a positron has a positive charge, which is why it's called a positron, or why the other is called an electron. No, it would be called a negatron. So, but in any case, yeah, they actually use antimatter. Radioimmunoassay test that combines radioactive chemicals and antibodies to detect minute quantities of substances in a patient's blood. Radioisotope, radioactive form of an element. Radiolabeled compound, used in nuclear medicine studies. Radiology, the medical specialty studying X-rays and other imaging. Radiolucent permits the passage of X-ray. Radionuclide, radioactive form of an element. Okay. Radiopaque is obstructing the passage of X-rays, like metal, fillings, knives stuck in your skull, Coke cans in your butt. Radiopharmaceutical, radioactive drugs used for diagnostic and therapeutic purposes. A scan, image of an area, organ, or tissue of the body obtained from ultrasound, radioactive tracer studies, CT, or MRI. Scintillography, diagnostic nuclear medicine tests using radiopharmaceuticals and gamma cameras. Okay, SPECT, single photon emission computed tomography. Now, yes, guys, they have equipment that can emit only a single particle of light at a time. Now, I know in scientific studies they use it because I've studied all that stuff, but I don't know in imaging why that's advantageous. Radioactive tracers injected intravenously, and computer reconstructs a 3D image based on the composite many views. Okay. Tagging, attaching a radionucleotide to a chemical following its path in the body. Tracer study, use of radionuclide. Tags travel chemicals and follow as they travel through the body. Ultrasound, great stuff. Use high-energy sound for diagnostic purposes. Creates an image. Uptake, rate of absorption, radionucleotide, organ or tissue. Ventilation perfusion studies, radiopharmaceutical followed by imaging its passage to a respiratory tract. In geography, we'd be studying the blood vessels. AP, anterior posterior. Barium is a common contrast substance, either swallowed or delivered as an enema. Oh, well, that's the next one, barium enema. C-spine, neck films, CAT scans, chest X-ray. Cubus means lying down. Echocardiogram. IVP studies the kidneys, as does the KUB. Both actually good. Lateral means a side view. Intravenous pyelogram, kidney areas, bladder. Okay. Different studies of the kidneys. Some of them use a contrast, and you can actually see as they take the X-rays, show it's starting to come down the ureters and starting to fill up the bladder and that kind of thing. It's pretty cool. Lumbosacral spine. L spine means low back. MRIs, we've talked enough about that. PA means posterior anterior, like a chest film. PET, positron, antimatter. We're almost done here, which is good because we're running out of time. T-spine, upper gastrointestinal, ultrasound, ventilation, perfusion. That's it. We did it. All right, guys, go back and look over this stuff yourself. It's great. X-rays are wonderful things. It's just opened up an entirely new field. We're running out of time, so Dr. Tom is going to sign off. See you next time.